If they have a simple vocal cord lesion, like say a polyp, there could be a procedure where we take them to the operating room and something that takes 45 minutes to an hour, we can cut off the polyp and then they can go home the same day usually and typically just rest their voice for a few days afterwards. And then we check them out a couple of weeks later, and if they're all healed, then they can go back to their full voice use. So typically those procedures have pretty quick recovery. There are other procedures that we do that involve vocal cord implants, and these are specifically for patients who have vocal cord paralysis. So those patients may actually stay in the hospital overnight, and we do the procedure in the operating room where we actually have the patients awake during the procedure, and we actually get down to their voice box and we carve an implant that is specific for them based on how their voice sounds on the operating room table. So it's an interesting procedure because the patient actually has a lot of input as to what their voice is going to sound like afterwards. It's pretty remarkable, the immediate improvement that the patients will notice on the operating room table. It's pretty emotional experience for them because for a lot of people they haven't had their voices for a long time, so it's a really rewarding experience to be a part of that. And typically patients just have to avoid heavy lifting for a couple of weeks and avoid going to concerts and yelling or anything things like that, but usually they're back up and running within a couple of weeks.